PCOS isn't just a diagnosis, it's a daily battle that can steal your energy, your confidence, and even your peace of mind. But what if the worst parts of this condition are the ones you've never been warned about? I'm here from Good Cuppa Health to help shine a light on hidden PCOS symptoms that doctors often miss, so you can take back control of your body and your life. Did you know that 1 in 10 women in the US may have PCOS and not know it? In this video, we explore PCOS symptoms your doctor may not tell you about and how it impacts your health. But before we discuss those, let's briefly talk about what PCOS is. PCOS is short for Polycystic Ovary Syndrome. It is a complicated hormone imbalance disorder that affects 1 in 10 women in the US, and worldwide, up to 116 million women may have it. Women with PCOS tend to have many cysts in their ovaries. These cysts are incomplete follicles on the ovaries, and because they are incomplete, it is usually hard for them to mature and create fertilized eggs. If you have this condition, you may experience symptoms like abnormal ovulation, irregular menstrual cycles, hormonal imbalances, and extra hair growth on the body. Another PCOS symptom is infertility, and it is considered one of the most common causes of infertility in women throughout the world. However, if you are a woman with this condition who wants to become pregnant, it is possible with the right PCOS treatment. You can still achieve a health and wellness-centered lifestyle with PCOS. Now we will look at the most common PCOS symptoms. The most common symptoms include irregular or missed periods, a hirsutism, more than usual hair growth on the body due to higher than normal androgen levels, for example, excess testosterone production, ovarian cysts, oily skin or acne, excessive hair loss, infertility or reduced fertility, a sleep apnea, a lot of weight gain, especially in the belly area. Here are hidden PCOS symptoms that might get overlooked. Chronic fatigue. If you feel tired all the time, this isn't just laziness. It could be an overlooked sign of PCOS due in part to hormonal imbalances. Brain fog. Insulin resistance is known to induce brain fog. Mental health struggles. Anxiety, depression, and mood swings could be tied to PCOS hormonal imbalances. Pelvic pain. In rare cases, some women experience pain in their pelvic area. I should point out that not every woman with PCOS will experience all these symptoms. Experts note that diagnosing this condition can be challenging because its symptoms mimic other conditions, and PCOS symptoms might have other causes. Generally, if you are diagnosed with PCOS, it means you have the most common symptoms of irregular ovulation. It creates irregular menstrual cycles and high levels of androgen hormones, for example, testosterone, and an excess of cysts on the ovaries. Did you know that experts have identified 4 types of PCOS? The 4 types are 1. Insulin-resistant PCOS. Insulin-resistant PCOS is considered the most common. 2. Inflammatory PCOS. Inflammatory PCOS may come from having low-grade chronic inflammation in the body. 3. Post-pill PCOS. Post-pill PCOS results from stopping the use of oral contraception. When oral contraception is stopped, the ovaries may produce high levels of androgen hormones. I should point out that not every woman who stops oral contraception will deal with these types of symptoms. 4. Adrenal PCOS. This type of PCOS comes from how the body handles stress. Adrenal PCOS is not affected by insulin or inflammation, but high levels of stress. If you have PCOS and find yourself dealing with any of these symptoms, how are you managing them? Let's get the conversation started in the comments section. You never know, your comment may help someone else. To find out the type of PCOS you have, go to your favorite search engine and type "quiz for the type of PCOS I have," or something similar. You will see different quizzes that could help you figure out the type you may have. What can cause PCOS? Experts still aren't clear about what causes it, but many well-researched theories suggest that multiple factors contribute to its development, including high androgen levels, genetics, insulin resistance, and chronic inflammation. Let's explore these a little further. High androgen levels. High levels of androgen hormones like testosterone have been known to disrupt menstrual cycles, leading to irregular periods. Insulin resistance has been shown to increase testosterone in women and contribute to PCOS. A very delicate relationship exists between insulin and PCOS. Insulin is the main hormone responsible for regulating our blood sugar levels. It gets released to lower blood sugar levels by moving the sugar into the cells so it can be used for energy. With insulin resistance, the ovaries create a lot of androgen hormones like testosterone. As mentioned previously, excess testosterone in women can lead to irregular periods and PCOS. Genetics. PCOS usually runs in families, with many genes affecting the ovaries and female reproductive hormones. Inflammation. Some experts and researchers believe chronic inflammation is an important yet overlooked factor in PCOS. Researchers from one study concluded, quote, "Chronic low-grade inflammation has emerged as a key contributor to the pathogenesis of Polycystic Ovary Syndrome," end quote. PCOS can lead to many health conditions including high blood pressure, type 2 diabetes, infertility, high cholesterol, endometrial cancer, sleep apnea, cardiovascular disease. I just want to quickly mention, if you're still watching this video, thank you. If you like the information so far, we encourage you to hit the like button. It helps us out greatly because it lets YouTube know that you find our video informative and helps us reach other women with PCOS. I previously stated a very common PCOS symptom is weight gain. But exactly how does this condition increase weight in some women? Remember when I mentioned that insulin resistance contributes to PCOS? Research shows it can also lead to weight gain and obesity. Insulin resistance could cause weight gain in different ways, including androgen hormone imbalances and excess blood sugar being converted into fat. Some women with PCOS who gain a lot of weight tend to gain most of it in their belly area. Insulin resistance also disrupts hunger-regulating hormones that can lead to overeating. Overeating can lead to weight gain and other health problems. Insulin resistance has been shown to reduce adiponectin levels. Women with PCOS tend to have lower levels of adiponectin in their blood. Adiponectin is a hormone that monitors fat and blood sugar levels and is known for its anti-inflammatory properties. As previously mentioned, chronic inflammation is linked to PCOS, and because of this, weight loss could be more difficult because chronic inflammation has been shown to increase weight. Even though weight loss with PCOS can be challenging, it is not impossible. Losing excess weight reduces the risks of diabetes, hypertension, and infertility. Women with PCOS could potentially shed unnecessary weight and reduce some of their PCOS symptoms by following some specific steps. If you deal with PCOS weight gain and would like to shed some pounds, you should check out our video on losing weight with PCOS.